ELBW Skin to Skin How-To video. This video was created by your SBU QI team to help safely guide you in helping your parents hold their intubated ELBW baby. First, gather your supplies. This should include a gown for the parent, warm blanket for baby, as well as a hat for baby, 2 to 3 pillows for support, and a reclining chair with breaks. If your baby has a central line, either a UVC or a UAC, or a PICC line, please make sure to grab the green Kelly clamps that will attach to the support wrap. First, make sure to pre-brief with your team. This conversation should include the parents, RT and RN, and any helpers that will be in the room with you, making sure everybody is adjusted. Please make sure to include what the plan is if baby is not tolerating being held. Informing parents what the plan will be if the baby starts to have a spell will encourage confidence and reduce some fear and uncertainty for them. Remind them that some spells are normal with organization time during transfer. Be sure to ask your parents if they plan on holding for at least an hour. Ask if they have had a chance to go to the restroom, for moms if they have pumped or need to do so first. Be sure to consider how long they plan on holding and coordinate that with your RT that's present as well. Please make sure parents know that they should not be on their cell phone when they're holding, as this is a safety concern for all intubated and CPAP patients. Once those questions have been asked, assign roles with your team. Who is overseeing the airway? This should be your RT. Who is in charge of the lines? This should be your nurse. And who is in charge of lifting up the baby? This should generally be the parents. Also, ask your RT prior to putting hands on the patient which way they're going to prefer the baby's head to face once they're on mom or dad. Next, you'll be applying the hat. Any ELBW coming out of the bed should have a hat on to help with temperature regulation. This is also the time to put the baby on the support wrap and take off the temperature probe so it doesn't pull when transferring from the bed. Your support wrap should be a folded warm blanket that will be folded lengthwise and rolled up on either side as seen in the video. This support wrap should be placed under the baby, and the idea is that that support wrap will be tucked under mom or dad's arms to create a better, more secure way to hold. Next, once the support wrap is safely put under the baby, the hat is on, you're going to put a roll for the baby to hold to help keep their developmentally appropriate positioning intact throughout the transfer. At this point, you can turn baby on their side so that they will be in the correct C-hold position for mom or dad to take out of the bed. While your hands are still on the patient and the RT is watching the tube, this is a good time to make any adjustments that you need to your isolette or your ventilator. Be sure to always remember to reapply the locks. At this point, you will be asking the parent what is a good bed height for them and lowering it for them to be able to safely lean over and pick up the baby. Once they've told you it's a good place, stop the lowering, and at this point you can pop the top and turn the heater to 100%. At this point, the nurse should be responsible for watching the tube while the RT is able to safely drop their side rail and open up the bed for mom or dad to come and lean over. Mom or dad should always be picking up on the side with the respiratory support device. As the nurse, make sure that you are untangling any IV wires or lead wires prior to turning the baby to face mom or dad for holding. Notice how baby is calmly positioned on their side with a roll tucked into the support wrap comfortably. Baby should not be flailing or stressed during this process. Once you have positioned the baby close to mom or dad to pick up, make sure you visualize your central lines. Prior to allowing mom or dad to pick up the baby, make sure that your RT has removed their circuit from the isolette. Instruct parents to pick up baby with the support wrap underneath them and bring their chest closest to baby and pick up like so, coming to a standing position. It is at this time, before the parent starts to step back, that as the nurse, you should tuck those support wrap straps under their armpits. This creates a more secure way for baby to be held and less flailing movements from the patient. Once the baby is secured and mom and dad feel comfortable with the support wrap, Next, you should secure your lines before moving away from the bed. As you can see here, we're going to be utilizing the green Kelly clamps to make sure that all of our central lines are organized and safely clipped onto the support wrap itself. Please make sure throughout this process that you are not clamping off any of the IV tubing. Once your IV lines have been secure, please double check them to make sure there's no tension prior to helping mom or dad walk back into the chair. As the nurse, you should be watching the IV lines, your IV pole, and your lead wires. Slowly guide mom back into the chair, and your RT will be watching and managing the airway. Help make sure mom is comfortable getting to a seated position. And make sure that you assess your lines prior to reclining mom in the chair. Again, there should be no tension on your IV tubing, and you're slowly going to sit mom back. Next, you're going to add in the pillows. Be very mindful when you are putting the pillows under the arms that you are not causing pressure on your IV lines or on your lead wires. Your IV and lead wires should be draped over the pillows, not under. The RT is ready and securing the airway. You're going to recline mom to her comfort level. Next, you will do the feet. Again, making sure that your RT is minding the airway prior to any movement. At this point, once mom is in a comfortable position, you should again check the integrity of your central lines and check the integrity of your secured lines to the support wrap prior to being done with the holding process. Now it is the RT's turn to secure the airway. The airway should only be secured once mom is in her desired position, as she has stated that she is comfortable where she is. Please remind mom at this point that her hand should always be resting on the back of baby's head to prevent any unwanted UPEs. Your RT should be using the arm on the ventilator to help secure their circuit once they have secured the ET tube. Once the ET tube and the ventilator and the circuit are all secured, the RT should measure the tube to make sure we are still at the correct depth. As the nurse, if you are in a room or a pod that does not have easy access to a parent call light, please make sure you ask the secretary for an ASCOM phone. In this ASCOM phone, you can program your Volt number to the just called list. That will allow parents to easily call you and hit send twice to be able to get in touch with you if there is an issue. You are also able to use the call light if you are in a room where it can easily reach to the parent's lap. Parents should be checked on when skin to skinning an intubated patient at least every 30 minutes. This check should include a check of your central lines, making sure that you visualize them, as well as making sure that the ET tube is visualized by a respiratory therapist every 30 minutes. Once it is time to put the baby back, make sure that prior to putting down the feet rest, you do not have any lead wires or IV wires stuck in the spots. Also make sure that mom's gown is tucked up underneath her legs so that that is not getting shut in the feet support as well. Prior to any movement, your RT should take the circuit off of the support arm, disconnect their airway securement from the gown, and physically hold the airway support themselves. Just be sure to remove the call light or the ASCOM phone. Move your lead wires and IV wires out of the way and put mom's feet in. After the feet, you're going to help mom sit up prior to removing the pillows. Take out one pillow at a time, again, being mindful of your wires. The pillows are removed and you have a good handle on your IV sites. Help mom come to a standing position. Please allow time to reorganize and move the ventilator prior to having mom or dad walk back toward the bed. Once all team members have vocalized they're ready to proceed with movement, guide mom or dad back to the bed. Prior to asking mom or dad to set the baby down, please make sure your IV lines and lead wires are out of the way and the baby can safely be laid down on nothing but the isolette mattress. Process might involve some untangling of your IV and lead wires, and it's best to do this before baby is laid down into the bed so that we prevent any tension from being applied to IV sites. Help mom or dad guide baby back to the bed. Again, keeping baby in this nice and wrapped position. At this point, it's now time for you and the RT to coordinate cares together and turn the baby back to the correct position. Be sure to help hold your ET tube for your RT so that they can adjust their ventilator, reapply the brakes, and put up their side rail of the isolette. This will also be the time where your RT is putting the vent circuit back into the isolette spot. Once the RT is securing the airway again, please be mindful to put your lead wires away, put up your side rail on the isolette, make sure that your IV lines are safely tucked away so that the isolette will not pinch them, and close the top. The top of the isolette should always be closed quickly to prevent any heat loss. Please also be mindful that the top of the isolette should be closed immediately after getting mom and baby positioned comfortably for skin to skin so that no humidity or heat is lost from the bed when baby is ready to go back. It is always a good idea after doing skin to skin to make sure that you change another diaper and do a quick set of cares. This also includes a temperature check to make sure that baby's temperature was well regulated throughout the process. Please remember to reapply your temperature probe that was removed prior to holding and take out your support wrap at this time. Also, please tell parents that this is a good time for moms, if they've just held skin to skin, to pump, as skin to skin is great for breast milk production and baby bonding. Please also tell parents throughout the skin to skin process that while we do not encourage them being on their cell phones, we are supportive that this is a very special moment for them and we would be more than willing to take pictures if they would like. If parents are requesting pictures, please make sure that the flash is turned off and a cell phone has been wiped down with our cell phone wipes prior to use. You are absolutely able to take pictures for them, but please, again, remind parents not to be sitting on their phones while they're holding. As parents start to skin more, they will determine what preferences they like in terms of how many pillows, how they like baby positioned, or what works best for them. Again, this video is just meant to be a guide and is meant to guide you if this is parents' first time holding, or if you are uncomfortable getting a baby out of the bed with an ET tube and lines. Please ask any staff members for help if you feel that you need extra hands, and please do not be afraid to loop in your CSL or your lead RT if there is extra support needed at the bedside. Parents can also be shown this video if they request to, if they need to feel comfortable with the holding process. We're happy and here to support them in any way that we can holding their baby. Thank you for watching, and please ask if you have any questions.